Hello students, today we shall learn another topic called as coronary artery disease. In short, it is called as CAD. Now this is somewhat similar or quite related to the one that we did yesterday, that is atherosclerosis. So I mentioned to you yesterday that atherosclerosis is nothing but the hardening of the arteries, or it's nothing but the buildup of plaque within the arterial walls. Now what happens, it can occur in any part of the body, and as I mentioned, this condition, if it occurs in the heart vessels, then that particular condition is called as coronary artery disease D. Now I hope this is familiar to you that I discussed yesterday. So atherosclerosis, how it actually decreases the lumen, which is nothing but the space or the passage through which the blood flows through the artery. Now the heart is supplied by the coronary arteries. Okay, so what happens is the blood flow is being brought to the heart by the coronary arteries, and that is how the muscle actually survives. Now what happens here, this has got like tree-like branches. The coronary arteries, when you look at the picture here, the reddish or the orangish part is nothing but the coronary arteries. So it has got the left coronary artery and the right coronary artery. On the left, they have two main branches, which is the left anterior descending artery, which actually supplies blood to the front portion of the heart, and the circumflex artery, which actually supplies blood to the lateral as well as to the posterior portion of the heart. Now, on the right, we have here the RCA, or the right coronary artery, which again supplies the lateral portion of the right side of the heart. Now, these are the main vessels. Now, what happens if these particular vessels have an atherosclerotic condition? Means there is a hardening of these arteries or a narrowing of these arteries. So, obviously, what is going to happen? The blood supply to the heart is going to be impaired or diminished. So, again, the heart muscle is going to be in a lot of stress, and eventually, this is how a patient will come into you by saying that he's got severe chest pain, and eventually he can end up having a heart attack, which is nothing but almost because of this lack of blood supply to that particular portion of the heart muscle, the tissue actually dies. So before that occurs, it's our duty as nurses or the healthcare team to save the patient by giving him immediate. Now, coronary artery disease, if you need a definition for that, we would say it as the disease which is developed due to atherosclerosis, nothing but the hardening of the arterial walls and the buildup of plaque within the blood vessels. So in simple, coronary artery disease is characterized by disease within the arteries that supply the heart muscle. Okay, and the disease typically develops due to atherosclerosis, which is nothing but hardening, and yesterday we have discussed all the causes about why this hardening occurs. So the same thing applies here, and the buildup of plaques within the blood vessels, which is nothing but the deposition of fatty substances, calcium, cholesterol, and all those fatty substances actually gets deposited on the walls of the arterial, on the walls of the artery, eventually causing the lumen to narrow, and definitely there's going to be obstruction in the blood flow. So this picture here actually shows you the red, like a branch like thing, is the coronary artery, and if anywhere in this vessel, if you find there's a blockage or nothing but a portion of the vessel where there is this deposition of fat, then you know that portion of the blood vessel, the blood is going to be flowing very minimal, and eventually the heart muscle is going to be receiving a less amount of. Now, in case if a patient is suffering from this particular condition, what happens is sometimes the particular artery that is supplying the heart muscle actually is totally blocked, and there is disease all over. So then what happens to the heart muscle? That portion of the heart muscle will not be able to receive the circulation or blood supply. So what happens? It is such a beautiful thing, because again, that is naturally what happens. The collateral supply gets formed. Collateral supply or collateral circulation means what? The tiny blood vessels gets formed. That occurs naturally, and what happens, because this portion of the artery is actually having the disease and it is not able to supply, this is the formation of the tiny branches. Okay, it occurs very naturally, and this will help in supplying the blood to that portion of the heart. And this particular what is that, this particular way is, or this particular you can't call it method, this particular way of sufficing or helping the heart muscle survive is called as the collateral circulation. So I hope you understand this. So collateral circulation, what happens is the arteries actually grow to make a natural bypass towards an area of reduced blood supply. So that's exactly what I told you. When I say bypass, it's nothing but wherever there is a blockage and where the artery is not able to supply blood, collateral vessels gets formed. Okay, so that becomes a bypass. Means what? In another source or another way, the heart is being supplied by blood. Now, what is ischemia? So all these are the terms you will be coming across, and you need to be familiarized with by yourself. So which is atherosclerosis, coronary artery disease, ischemia, and see, though these are all the common words or terms you will be coming across in this particular system when we are studying the cardiovascular system or the CVS. Now, what is ischemia? Ischemia is nothing but a sharp cramping pain in the heart muscle. So that at that time, what happens? The kind of symptom the patient experiences is a very sharp throbbing pain in the chest. Okay, this kind of ischemia can also occur in the leg. Okay, so when there is when I say there is pain in the leg, then that particular term used for when the peripheral vessels are diseased, or when the peripheral vessels are affected, and the patient is having severe blockage somewhere in the peripheries, and what happens again, he is going to be experiencing this excruciating pain either in the hands or the legs while walking, and that particular term we use is claudication, which means there is some kind of a diminished blood supply to that portion of the body, and that is the reason why he's feeling that cramps or the cramping pain in the leg. Now, if the same thing occurs in the heart, then again that particular term used is ischemia. Okay, so ischemia happens most often when the heart needs extra oxygen. So here what happens, the demand of oxygen is more, and when the body is not able to supply that, and that is when the patient ends up having a severe chest pain, eventually ending up in a myocardial infarction, also known as in simple terms, known as the heart attack. Now, when does a body require this extra oxygen? Is usually when a person is physically involved, like doing extra work, he's extra active, running, jogging, when you're doing your treadmill, and when he's excited, when you're in a stressed mode, when you're exposed to even weather conditions which are very cold. Okay, so that is when the demand of oxygen is actually more, and when this does not happen, and that is when you will start experiencing the symptoms like chest pain, and this particular medical term for this is called as where you also end up doing an echocardiogram, and just to know the functioning of the heart chambers, the effectiveness of its contractility and more. But most of the time, yes, definitely in a patient who walks in with a chest pain, yes, ECG is a must and blood tests are very important, and these two diagnostic tests will definitely reveal if the heart is in a lot of stress and what the patient is experiencing and what can be the. Now, who is affected with this coronary artery disease? Yes, definitely both men and women. Okay, and also patients having risk factors, and this risk factors, as I mentioned yesterday, as in atherosclerosis, the same thing applies here as well. So along with risk factors, again, as I told you, it is nothing but the comorbidities, the lifestyle of the patient, the general habits of the patient. When I say habits, it's the smoking, alcohol, excessive maybe drug use, and again, stress is another important factor. So when a patient is involved in all this on a daily basis, he's not able to cope with all these conditions. All these comorbidities are also going haywire. He's got high levels of sugar, high levels of the blood pressure. It's not getting under control, and also add on stress. Then definitely the patient is going to be in a severe risk category of getting this particular disease. Now, let's see what are the causes of this coronary artery disease. Same way as we discussed yesterday, again, it is smoking, high blood pressure, high cholesterol, diabetes, and a sedentary lifestyle. Okay. Again, obesity is one of the important factors along with stress. So, keeping your body weight under control is in every person. Risk factors, again, we have two classifications here, which is called as modifiable risk factors and non-modifiable risk factors. So, modifiable means obviously what? Yes, a change can be brought about. You as a person can think about living a better lifestyle, so you can bring the changes in you. Whereas in a non-modifiable risk factors means what? Something that cannot be changed, and such factors include your age. Yes, we cannot bring a change in that. Your gender, also your family history, and also your personal history. So all these are things, because as I told you, some of this can be genetic, it can be inherited, especially when a family's got severe strong history of cardiovascular disease. Yes, there are likeliness, yes, that the next of kin, or the maybe from the parents to the children, yes, it can be inherited. So once you know that, it's very cautious or very important that the person becomes vigilant about this, and he takes all precautionary measures right from the start, because he does not want to end up having the same disease as his parents. So that is how we say you have to be extra cautious. So you have to be very alert about your diet, that you're eating a balanced diet, means you're eating everything properly. You should not be indulging in all this unwanted lifestyle habits, and also kind of coping with your stress and keeping your body weight under control. Okay, and modifiable risk factors is nothing but which you can bring a change. So again, as I told you, in case you go in for a blood test and you realize that after doing a lipid profile or a complete blood profile, you realize that you have high cholesterol levels. So yes, what is the ways to deal with it? You will first be cutting down on your junk food. Okay, you will be eating less of fatty foods, you will be eating less of fried foods, you'll be eating less of outside food, and you're just trying to maintain the habit of eating at home, healthy. And yes, occasionally outside is fine, but again, that does not become a habit in you. You'll be trying to cut down on your smoking, your alcohol, and also trying to cope with your stress levels. So again, coping with your stress levels, maybe you will start to do kind of activities which gives you peace of mind, or which relaxes you a bit, like yoga or meditation. You may be going to the gym in order to burn that excess fat, or you will be trying to work out more, you'll be more physically active, or in a simple way to say, at least walking at least a minimum half an hour every day will be actually very helpful for every person. So these are the ways you try to bring about the changes in you once you realize that you are in the risk category, or if you realize that yes, in this world of today, where everybody has the sedentary lifestyle of on the run, on the go, not having a breakfast properly, not having the time to sit down and eat properly, you don't really watch what you're eating. So when all this is happening, yes, it's important that you ensure that you keep yourself fit and you keep your weight under control. You manage your sugars well, and also very important, you don't get stressed, and eventually you kind of manage your blood pressure as well. So these are the risks of CAD. Now, when a person having the CAD, how does he exhibit his symptoms? So the symptoms again is definitely going to be severe tiredness, severe breathing difficulty, lack of energy. Obviously, you can start off by having a chest discomfort. When I say discomfort, is something but something that is not quite right. You don't feel, you don't feel easy. So when there's some kind of a chest discomfort or a chest pressure, okay, something heavy on your chest, this can also show up as a severe sharp pain in the chest. Okay, that also can occur. And also when the patient may also start exhibiting pain when he's having a radiating pain. When I say radiating, means what? It is traveling or it is moving from one spot to the other. So it can radiate from your chest through your arms to the left arm. Again, you might start feeling all the pain in your arm as well. Eventually, this pain can radiate to the neck area and to the jaws, and also it can go to the back as well. So once a person starts exhibiting all the symptoms, then yes, you can likely expect that he may be kind of eventually heading on to having a heart attack. And so for this, what happens? Immediate medical attention is required, and he has to be checked and tested as early. So these are the just symptoms which with a picture or a diagrammatic representation. So normally what happens, yes, dizziness, which is again means what? There is no adequate blood supply, the person is not having adequate output, the heart is not able to function effectively, so the rest of the body is not receiving that adequate blood supply. So means definitely the brain is not getting that adequate circulation. So yes, the person may be exhibiting symptoms like dizziness, shortness of breath, chest pain, nausea, excessive sweating or profuse sweating, and a rapid or irregular heart rate, which is nothing but arrhythmias. So all this again you will not be able to see. So again, once you feel the pulse, yes, you will feel that yes, it is thumping or there's a fast heartbeat. But all this can be rectified once the patient gets to the hospital, he gets monitored, and an ECG is done on him, along with some bloods are sent for investigation. So once all these reports are being available, then we realize that yes, once you look at ECG and then the changes are very clear, then you come to a conclusion that yes, this person is having a particular coronary artery. So diagnosis again is nothing but history collection, physical examination, ECG, blood profile, which is a strict follow-up through the cardiac enzymes, which is very, very important, because these enzymes are usually released from the body, especially when the heart is in a lot of stress. Okay, so cardiac enzymes, CKMB, troponin levels, all these are the cardiac enzymes and proteins as well. So when the heart muscle is in a lot of stress, then what happens? The body tends to release these proteins and enzymes, and that is when you know that something is not normal, and you can finally know that yes, the person is having or suffering some kind of a disease as well. Okay, so electrocardiograms, nothing but ECGs. Echocardiograms, as I told you, is nothing but to know the functionality of the heart, how the chambers are functioning, how they are contracting, how much of blood is actually flowing, what is a cardiac output, which is nothing but the amount of blood the left ventricle pumps into the aorta, and from the aorta it goes to the different portions of the body. So all this will be thoroughly investigated and studied when you do an echocardiogram. Also to know how much of pressure or how much of what is that, especially when I mentioned the heart is in a lot of demand for oxygen. So how much your heart is actually asking for, and how much your heart actually can tolerate. So all this can be assessed by doing a stress test, because what happens in a stress test is nothing but you put the patient on a treadmill. Okay, you do the parameters, you do the settings, and you're just walking on it. So with that, what happens, you get worked up and you start walking faster. The heart also begins to beat faster. So that means it's in a lot of demand. So is the heart actually receiving that much of blood? So at some point of time, the patient will start to feel palpitations. He may start sweating, or with the profuse sweating, again his blood pressure can raise, and he can start having a chest pain. So that is the time you stop the test, and the doctor or the cardiologist is going to review the patient and assess the patient. So at that point, you know that yes, when a person is in this particular condition, yes, he is going to be experiencing the signs and symptoms, and this is related to the stable angina, as I told you, when a person is in a lot of stress. So that is how we do different tests or various diagnostic tests, just to make ourselves sure that yes, the person is suffering from this particular disease. And nuclear imaging again is nothing but the radiation tests or reports that we get in order to assess the condition of the heart. And of all, after doing all this preliminary diagnostic investigations, you eventually end up having an angiogram. So angiogram, as I mentioned yesterday again, is nothing but you inject dye or contrast medium through the heart arteries, and that will actually pick up the regions where the blood vessels are narrowed. So that actually shows there is a disease there, or there is a sclerosis there, or there is a plaque there, and that is a portion of the heart which is not receiving adequate blood, and is why the person is having the chest pain. So angiogram is a diagnostic tool to actually tell you where the problem is, why the patient is experiencing this chest pain, and it actually picks up the exact spot about where the pain is occurring. And eventually the cardiologist can go back and fix the, which is nothing but he opens the blockage by putting in a stent, and that is how the person is going to be treated. So these are all the this particular disease condition. Again, this is just giving you in details about what happens. Now management again. To begin with, yes, the most important step that we all need to take, as I told you, is to reduce the risk factors. So once you know that you're in that risk category, or if you know about yourself that you're not eating right, you're not eating healthy, you're not able to do some physical activity, you are in a lot of stress, you're not able to cope with your stress. So with all this, what happens, yes, you need to make sure that you settle down and you are under control. So, and bring about some changes in your habits means what? Make sure you eat on time, you keep your blood sugars under control. If you're, especially when you're a diabetic, or even if you're not, you make sure that you don't end up getting diabetes. So make sure from the beginning you're eating right, eating on time, the portions are under control, you do a lot of physical activity, you do a lot of workout, and make sure at no matter what the reason is, you will walk at least half an hour a day, every day, and you continue this as a routine. Make sure you limit your, in case if you're a smoker, I would say try to avoid. So if you've been smoking for long, then you cannot do an abrupt stop, but try to limit, okay, and eventually come to a stop. So same with alcohol, and in case you're you are into drugs, so kind of stop all this, because that's going to put the heart into a lot of pressure, and also increase your activity levels. Make sure you maintain a good body weight, which is very, very crucial. As I told, obesity is also one of the killers, or obesity is also one of the causes for severe cardiovascular disease. Okay, and especially, and with that, when I say, it is nothing but it's associated with how much of junk food you eat. So all that is that shows that you don't really care about what you're eating, you're not watching what you're eating, you just love those fried stuff, and you just love those kind of food on the move or on the run. So that is how people end up having this kind of eating the junk. And if you're a person who's always at the desk sitting and working, then ensure that you take a walk. Make sure you walk around, make sure your body is getting this adequate amount of circulation, no blood is being stopped. So all this is what you have to take, the simple steps or measures to make sure that you're managing yourself. Now, if all this is out of control, even after, in spite of doing all this, you still need help, then what happens? You go to the doctor, follow up, and then the doctor may put you under some medications to kind of control your high blood pressure. Okay, so that keeps your blood pressure under check, and he may check your blood sugar levels. Again, if that is also high, then yes, you may be on some tablets, and if that still doesn't work, then you may be on insulin. So all that is a decision of the cardiologist or the treating doctors, what you need to be on. But again, this will not be done straight away, but they will give you a chance where you try to bring about some modification in your lifestyle or in your behavior, and only then the medication part will come into play. Okay, and also in some reason, if you kind of maybe just to keep your blood thin, so that, again, when I say blood thin, yesterday I told you that sometimes there are blood clots which actually obstruct your blood vessels. So again, to keep your blood thin, you can be on aspirin, and which is thins the blood. It also takes care of your pain as well, in case, because pain again is nothing but because due to the blockage of the artery. So the person may be on tablet aspirin as well on a regular basis. And these are all, when I say beta blockers, calcium channel blockers, nitroglycerin, ACE inhibitors, all this is going to ensure that your blood pressure is under control, or it's. Now, in spite of medications, again, some persons may not respond quite well. He may still kind of be feeling this fatigue and sweaty, and he's not able to perform any activity for long. Immediately he starts to feel the chest discomfort, chest pain. So what happens to these people? They go back to the doctor again. They tell the doctor about what they're experiencing, and then the doctor will decide, yes, okay, let's do an ECG, find out what's going on, let's do a blood test or a complete blood profile, let us assess your lipid profile, means your complete cholesterol, check your cholesterol levels, also let us assess the cardiac enzymes, what is going on. Okay, so all this is going to be done, the investigations are going to be done, along with what maybe the doctor will suggest for an echocardiogram, just to know the function of the heart chambers and also the heart valves. And the last thing, the doctor will say that yes, let's do an angiogram and check what is going on. So angiogram is a good choice, because with that you will be able to really spot out how the coronary arteries are. Nothing but how the blood vessels that is supplying to the heart are they in a good condition, are they in a healthy condition, are they even throughout. Okay, is there any narrowing somewhere, is there any blockage somewhere? So all this is going to be thoroughly assessed by the cardiologist, and this particular procedure will be done in the cath lab. And with that, doing this procedure, again, this is again, as I mentioned, it's a diagnostic tool. So with this, you will try to find out, or you will come to know where the blockage is. Okay, and once we know that the blockage is more than 60%, so that is how the doctors assess. If it is like 50% or less than that, you will be on medication. So the medications will keep it under control, the blockage will not increase. That means you will be on fibrinolytics, which, as I told you, taking care of your clot. You will be on antilipids, again, which is taking care of your fatty substances and your cholesterol levels, and also you'll be on aspirin, again, which is thinning your blood, which is not keeping your, in case there's pain, under control. So all this, your blood pressure check is also very important. Your sugar levels, you may be on sugar tablets, again. So all this will be your medication or medical management. Okay, so if the blockage is like 50% or less, but in case if the blockage is more than 60%, then yes, you need help, and that is when the doctor will fix it by doing a procedure called as PCI, percutaneous coronary intervention, in simple words known as angioplasty. Okay, and angioplasty is done by using a balloon, and which you will be studying eventually in the following chapters, and by putting a stent in. Okay, so stent is another small device, as I mentioned again yesterday, that it is like a spring like device which actually sits inside your coronary arteries, and this actually keeps the vessel open. So these are the ways you can fix it. Now that is the option that the patient has got, but sometimes what happens, especially diabetics, they may end up having very thin blood vessels. Okay, and maybe you cannot do an angioplasty on them because the vessels are very narrow and very thin, they are very curly or very coiled. Okay, in such cases maybe you cannot do an angioplasty. Also maybe the patient has got more than 3 or 4 blockages. So what happens, you cannot be putting stent everywhere. So then the best option for such patients is they will go and have a coronary artery bypass graft, nothing but in short called as CABG. Okay, so coronary artery bypass graft is nothing but a surgical procedure which is done in the surgical OT and done by the surgeons. So what happens is they will bypass. I will be showing you all this in the future lessons. They will bypass the arteries. Bypass means what? They will be giving new connections or new supply of blood or of blood to that particular portion of the heart, so that the heart is not deprived of any blood supply. Okay, so that is called as the coronary artery bypass graft. So these are the ways how you will manage a patient. So eventually you will start out with bringing about modifications in your lifestyle. The next, even if that does not work, the doctor will be treating you medically, or medical management is being provided. Even if that does not happen, then you will come into the interventional procedures like having an angiogram done, and if it is fixable, yes, you will be having an angioplasty. And even if that also does not work out, then the ultimate option or choice that the patient has got is nothing but to have a bypass. Now that is all the management that is related to the medical as well as the surgical management. Now nursing management, which is very important of all, you will start by writing a thorough physical examination. Okay, you have to do a thorough physical examination. The nurses have a lot of role to play from the nursing point of view, and you will do all the investigations, make sure the reports are there, and with the entire medical team coming to this decision, you as a nurse also should be in a position to treat this patient suffering from this pain. So you will be learning how to read the ECG, you will be assessing the patient, and then eventually conclude by how to provide the care to the patient by prioritizing the patient's problems or the complaints. Again, in this particular condition, definitely the first priority is going to be acute pain. Okay, I'm not going to be reading the diagnosis in full, because I'm sure by now you know what is nursing process and how to write the nursing diagnosis. So the nursing diagnosis as per priority will include acute pain. The next one can be decreased perfusion, which is nothing but the body is not able to receive adequate blood supply to the entire body. The third can be activity intolerance. The fourth can be anxiety. The fifth can be risks for due to decreased cardiac output, because risks are also important. The complications are very important to mention, because when the person or the patient is having this disease, we try to ensure that he does not end up having complications. So before that, you want to treat the patient thoroughly and ensure that he does not end up having any sort of complications which is going to put him in a lot of problem. And the last but not the least will be deficient knowledge. Okay, so deficient knowledge, again, the nurse will be doing a lot of counseling and education or health education in regards to your to the patient's diet, physical activity, lifestyle changes, taking care of his body weight, trying to cope with his stress, how to manage his medications, how to ensure that how to take care of himself after having an interventional procedure, and also very important, how to take care of himself after having a bypass surgery, and trying to explain the drugs to the patient, importance of having the drugs on time, importance of still keeping his blood sugar under check, under control, importance of still keeping the blood pressure under control and under check, also making sure he maintains a good body weight, he is physically active, he's able to manage his stress, and also in a way that he's trying to change his lifestyle habits. So all this will be the kind of health education or the counseling that the nurse will be offering to the patient as well as the And yeah, the home remedies for coronary artery disease, nothing but the preventive aspect or the health education which I just mentioned to you. So these are the different things that you will explaining related to your lifestyle changes, your habits such as smoking, your alcohol, you're trying to manage your stress, keeping a healthy body weight, exercising regularly, eating right, eating a balanced food, keeping your blood sugar as well as blood pressure, and very importantly your cholesterol levels also. So I think with that we have finished the topic for today, which is another simple topic called as coronary artery disease. So, and in case you need extra what help with your nursing intervention, you can actually visit this website, which is called as nurseslabs.com. Okay, this is a very good site where you have the entire nursing interventions related to any kind of disease, related to your different systems, any sort of disease. You just go there, check it out. You have your nursing interventions, you have your diagnosis, you have the entire nursing care plan, and what are the nurses' roles and responsibilities to do. So it is a very good site for nurses. Go and have, in case of any doubt or you need extra information, please visit this site, and you will be knowing how to manage a patient with this particular disease condition. With that, I finish the topic for today. Thank you for your time.